Hi, my name is Madelaine. I'm a pelvic floor physiotherapist, the owner of Eco Physiotherapy, and a new mommy. So today's video is called, Do I Have a Rectus Diastasis? So what this is your rectus abdominis muscle, or aka your six-pack muscle, located here in the front, gets separated. There's two reasons this can happen. The most common is obviously pregnancy, but you can also get it if you happen to gain a lot of weight. Now, what I'm going to show you is some ways that you can test to see if you might have a rectus diastasis, and if any of these tests come back as we call positive, then I would suggest seeing a pelvic floor physiotherapist to work on getting it corrected. So the first way that you can have, the first clue is the mummy pouch. So you've gotten back to exercise, you've been doing your core, you've been doing your ab workouts, and you just can't seem to get rid of the mummy pouch. So what we're talking about is this little part here that just doesn't seem to go away. So this is called the mummy pouch, and if you can't seem to get rid of it, it might be an indication that you have a rectus diastasis. The next way that you can determine whether you have one requires you to lay down. So I'm going to lay down now. So what you want to do is, laying down flat, you want to lift up your head, and if your tummy does a tent, so meaning it bulges outward versus being flat, you may have a rectus diastasis. So for example, when I lift my head, you can see that there's like a little hill, and this means likely that I have a rectus diastasis. This can be further confirmed with the finger test. So what you want to do is you want to get 3 fingers, and we're going to test in 3 different spots, just above, at the belly button, and just below. So what you're going to do is, with your 3 fingers, you're going to place it in the middle, kind of pressing into the skin, but not too hard, and then you're going to lift up your head like this. So what you're looking for is, you're feeling for the edges of your muscle. So as you can see, I have 2 fingers. So the edge of my muscle is on this side and on this side. So what this means is I have 2 fingers separating the muscle. So this is a confirmation that I do actually have a rectus diastasis. So 1 finger is considered normal. So now what I'm going to do is I'm going to test at my belly button. So I'm going to place my 3 fingers at my belly button, and then I'm going to lift up my head. So same thing here. I have 2 fingers, so I can feel the edges of my muscle on either side of my fingers. So again, this is confirmation that I have a rectus diastasis. Lastly, I'm just going to test below my belly button. So same thing, 3 fingers, and lifting up my head, and here I only have 1 finger. So this is considered normal. So basically I do have a separation in the abs here in the upper part. Alright, so if any of these tests are positive, make sure to go see a pelvic floor physiotherapist, because having a rectus diastasis could lead to some other issues. So you definitely want to have it addressed and checked out. Thanks!